This is going to be three sessions of debates which we're going to have this time. Two accomplished surgeons, both believers in their own technologies by right. We're going to have just 5 questions, and they have to defend themselves, and audience should also can join in and see who is right and what is right. So we'll start off with today. Tomorrow we have eye rubbing versus the eye rubbing hype or reality, and then your debate, cross-linking hype or reality. So we're going to have 3. So let's have the first question, please. So what do you really think? I will ask Madam to speak first. I mean, let's be very honest here. There's no Zeiss team, there's no Alcon team out here, I hope. So is it really a hype for you? Is the hype faded? Yeah, smile, okay, or
so Flapless.
The whole debate of Flapless, the whole concept about it.
The whole concept.
I think you guys can also ask questions.
I think the concept about.
Let's not make it very simple for them.
I don't think there should be a debate between flap versus flapless procedure. I think each procedure has its own role in the entire gamut of refractive surgery, and I think it is hyped.
For the whole debate is hype, or the whole?
The whole debate probably is hyped because there is definitely a role of each technique for a particular indication in a refractive surgery setup.
Okay, then we'll just skip this question. Okay, I would like to ask Dr. Rajesh about this. I know you're going to speak about it tomorrow. How much is noise and how much is actual music when there are published reports today which says that one procedure is stronger than the other, or one procedure is no risk than the other, or the one procedure has better outcome? You can answer about it. First, let him answer about being stronger.
It's about the kind of music you love. So you can be very selective, you know.
Yeah, I was going to say
so
that
if you don't
one
like a
person's
particular
music,
it can sound like noise to you. So
yeah, one
if you
person's music
selectively
can
look at
be
it,
sure to for somebody else.
But I think between the two procedures, what has been going around is that the perception that's been created that one is superior over the other, which is not true.
I'm not the one propagating that.
Let's be frank about it.
So
even in your clinic or in your practice, patients are being given the idea that a smile procedure outperforms LASIK, whereas if you review the literature, I don't find compelling evidence to prove this point that one is superior over the other. Back in 2007, when PRK, prior to that, PRK was the only approved procedure for US Navy and the US Air Force, which was the approved procedure. 2007, the femtolasic became the approved procedure both for US Air Force, Navy, and the NASA astronauts. So you can understand that unless the outcome was guaranteed, or you knew that the person would not lose the quality of vision which can affect their profession itself, the procedure would not have stood the test of time. And now you have a new procedure that's come. That's great. You remove a lenticule, which sounds, theoretically it sounds more, but when you, without having convincing evidence, if you add benefits, so-called benefits, then this is something that becomes very difficult to, compare and look at it.
I want the judges to tell us which side you want to play the game now, with her or with him.
I pretty much agree with Rajesh. I think we have very little data to show superiority of one over the other. I think our understanding, and I'm not a big biomechanic person at all, but I think our understanding of biomechanics is very, very limited. And I think I always look for analogies. And if you take plywood and you delaminate it, which is what effectively smile is, you've weakened it substantially even though you've not removed any tissue. So I'm not really...
But
so
smile procedure is not only about preserving the biomechanical strength. Simply not having a flap in the eye is also having a guarantee of not having a flap displacement, not having any stray, not having any disturbance in the way you would, and induce more aberrations in the way you would put your flap back or the way it would heal,
Well,
and not leaving
you
a
do have
scar
striae.
there.
You do
So,
have striae. Anytime you try to fit
so there
something
are
in,
other advantages
Okay.
besides just having the biomechanical advantage, which is maybe.
What do you think is real big advantage? Let's forget biomechanics out of it, of say spine. Because he picked up a lot of biomechanics as what is the noise in literature, and Dr. Bellin also said there is more noise on biomechanics in the literature. Let's forget about that. Let's assume that's noise. What's music for you?
So music, I would say, is the appeal to the patient of not having a flap in their eyes. It's also the recovery as quick as what you would expect with a flap procedure as compared to a surface ablation procedure, and with the same or nearly the same advantages.
Dr. Farad?
Just an anecdote. In 2016, Walter Secundo, one of the two smile inventors, contacted us and asked us whether we could measure the biomechanics of smile. And I was surprised because this machine has been on the market for years. And I asked him, Walter, this must have been done. He said, no, there's nothing published on it. So we did 2 IRVS papers showing that smile is biomechanically better than a flap-based procedure. But I just wonder, you have noise, music, where on earth is the symphony?
I'll ask
Where is
Dr.
surface
Rajesh this
ablation?
question.
Where is surface
I'm not
ablation
noise.
in here?
Okay.
No, I'll ask this question. Was that noise or music for you?
No, the same thing. If you look at this year, Kanellopoulos has published another study looking at donor corneas where he has done LASIK for 3 diopters and 8 diopters versus doing the smile. And he has done biaxial XY. He has looked at the stress and strain and the Young's modulus, and they found that for up to -3 diopter correction, smile weakens the cornea 24% more than LASIK, whereas 8 diopter, both of them are similar. There's another study looking at corneas where they did smile using 110 microns and 160 microns cap, and both the corneas, when they increased the pressure within the chamber, showed steepening of the cornea. So biomechanically, they found that it did alter the corneal property, so it did not retain the corneal strength. I have no bias to either of the procedure. I'm just quoting what studies we look at literature. I still remember when you published this paper, what you're referring to. I did send you a email or a message on that saying that this one does not have the healing response of the flap. So you cannot really compare the two, because in a donor cornea, when you just create a flap and put it back, it's not like doing an in vivo. In vitro, you cannot replicate the healing process that happens at the edge of the flap.
Oh, absolutely, but why on earth don't you have PRK as the third option here? I would neither do LASIK nor smile. I would do PRK.
I would put PRK as the top of the pyramid. PRK is the first one.
And then this is the fight for the second position.
Second position.
So let's assume, the question which is asked, this is a question for Dr. Rupal. Even you started Smile and you've been doing it for so many years. Is this true? Not at your skill, but somebody like who wants to start, say,
No, so I have been training people, and I've been training both for a flap procedure with a microkeratome, with a laser, and the smile procedure. So I've been training people, and they come at all levels. And I find that there is a slightly more or a steeper curve, a learning curve for smile as compared to a microkeratome LASIK. But femto LASIK and smile, I think they have the same learning curve.
I'd like to ask Professor Bellin out here, is this true in US? Because in US, it's just got it now. I hear 2 versions from surgeons. I have 2 versions from surgeons. One version is that they like it, and the second version they hate it. There's nothing in between in US. Do you agree with this?
As far as Smile goes?
Yes.
Smile has a minuscule penetration in the US market.
Why is that? Is it because of this? Because of a steep learning curve?
No, I don't think, for those of us who were involved in training, if we train residents who've not done even PRK, there's a steep learning curve. LASIK has a steep learning curve. I don't think SMILE is any steeper, because usually people doing SMILE are already people who are doing refractive surgery. So I don't think the learning curve is that very different.
Why do you think is it because of the stringent rules by FDA about cylinders not being able to treat?
It's limited, and I think they've just recently expanded their approvals, but limited approval. And from a financial point of view, as you all know, what costs $5 in India costs $500 in the US. So it is extremely difficult from a financial point of view if you already have an active refractive practice to add SMILE, because it really doesn't expand your treatment modalities enough or treatment range enough to validate the expense.
So all of us agree there's no learning curve at all in SMILE?
No, there's a learning
I
curve.
think there is a
Everything has a
It's
learning
stronger,
curve.
it's more
I
than
don't think
LASIK
it's
then.
anything different than almost anything else.
It's more than LASIK.
There's definitely a learning curve.
It's more than LASIK.
It's more than microkeratome LASIK for sure. And I think I was actively involved in this FDA approval for the US. And I think the thing that's hurting the US market is, one, that there is only one company which is pursuing this, and therefore the access to the technology is limited. And two, because they don't treat cylinders, and we have also found that in most refractive surgery patients, there is some little cylinder which always needs to be treated. So there are very few pure spherical errors that you come across. And therefore, the results are not going to be that gratifying for anybody. Even if there is a 0.75 cylinder left, you're not going to be that happy.
So hopefully when the cylinders also come, the penetration is going to be better, hopefully. There's no real answer question to this. I don't think we need to ask because we don't have a proper answer. Like you may have an answer and both may be right and she may have an answer to this. So we can go to the next question. So this is what we have been debating on. So anything else you want to debate on science where you don't like this technology? Not like, I'm saying for the sake of debate, which she can defend it.
Okay. LASIK flaps have got better with the use of femtosecond laser. Without having the meniscus edge, we now can have a perpendicular or a reverse angle flap, makes it more stable. So the flap-related complications with the femtosecond laser flaps are much less than what we used to have with the
But not a
microkeratome.
zero.
That's true for SMILE as well. You know,
No,
retail lens-
flap-related complications is zero in a SMILE procedure. However little, but it's there when you create a flap.
Okay, let
Just make a quick
me
comment.
finish the entire
Gosh,
thing.
just a quick thing. Lenticule-related complications are zero in LASIK.
Yes.
You know, it's a stupid comment.
Ablation-related procedure, ablation-related complications are
number
zero in
one,
SMILE.
Flaps are more predictable. Second thing, centration, eye tracking, and cyclotorsional control are absent in SMILE. So you still have to manually center on the cornea. Your excimer laser, you can calibrate it, a test object, calibrate it, so you know exactly what you're going to ablate. SMILE works by femtosecond laser making 2 cuts. And we know that the variability of a femtosecond laser cut is somewhere between 5 to 15 microns. And if you make 2 cuts, your variance can go as much as 10 to 20 microns, which is almost like 0.75 to 1.5
Can I answer
diopters.
one at a time? Because
Yes, I will repeat the point for you. So that's why last year you have 2 papers published where
Where do I
the
stand?
enhancement
That
rate
side or
after
this
SMILE ranged from 2.5 to 2.9%. And
Wait,
all
do I
these
stand that
enhancements
side
were
or this
done
side?
within the first year, and in both
both
the
the
papers
screens
they had to do
have,
topography guided PRK to correct the power. So that shows that there are limitations with what your
And then
refractive correction can achieve as compared to what you can do with a topography guided or a wavefront optimized laser procedure using the a flap based
I
procedure.
just want to ask a question. How many of people here use SMILE in the practice? What is your, you've been using more than, what is your, do you believe that that rate of 2 to 5% is true in your practice?
I would put it at below 1%. Yeah,
That's okay. That's okay.
it's just about below 1%. I've done about only 300 odd SMILE procedures. I've done 2
how
enhancements.
many
Two
treatment?
enhancements I've done.
How many cases
That's
have you
what you
done?
do.
I've done
already?
about 300
When
eyes.
you-
if I know
300 eyes and
Before you
two,
talk-
2 eyes you needed
2
an
eyes.
enhancement.
Before you go to actually podium,
That's
you can
much
analyze
less
the
than
audience
even
from the side.
1%. Anybody
So-
else here who has?
Lot of
What's
time.
your regression? What's your
I
enhancement?
don't need it now, but
So Rajesh, I can
initially
just say
when you
Anarika
were
still
khelna
here,
khel ka
when you want to
satyanash.
This is not my, I
get used
don't
to
do
this
smile,
thing.
I'm just quoting
No,
the
I'm
study.
just
Go and
quoting
stand
that
and have a
In
look.
one
particular
of the
study.
studies, it's almost 9,400 eyes, out of which they had to do
So
almost
how much was
70
your
eyes.
enhancement rate?
It's even less than what Gaurav has, and this was without any nomogram adjustment, the first 1,000 eyes that I treated.
Then you should publish this.
I have published it.
So then you have not picked it up.
I didn't find it in a PubMed search when we tried to look at enhancement rate and
But,
smile.
but you found only one published study which
studies.
showed,
Rajesh
and both
picks up
showed 2 to
selective
5.
Both have been published last year.
So you are biased. You're not
I'm not
looking at all
biased.
the studies.
Moreover, Rajesh,
Please-
there is
please email me
that
your
question
paper.
that you asked about the depth of, with the femtosecond, the accuracy. Now, the thing is that, there may be differences of 5, 10, 15 microns, but they will be replicated at both planes. So if the femtosecond is doing a cut for the cap and the, lenticule, if they will shift, both of them will shift.
Yeah,
by 5 or
Gaurav,
10
you're
microns.
taking away my thunder.
So I think what she's saying is you're cherry picking your points. That is that her present publication shows that it is less
I'm only
than.
quoting what I found online on PubMed. I don't do smile.
About
I can talk about
variability-
LASIK, and I can tell you in my last 8 years of doing LASIK, I've not enhanced even a single patient, and I do about 400, 450 eyes a year. So in last 8 years, you can say that's out of about, about 3,000 eyes.
Yes,
I've not
please.
enhanced a single eye.
I have a
Yeah.
question to anyone here who does smile. Does anyone who offers smile only offer smile?
Sorry?
Do you offer only smile?
No?
Okay, so there's a reason for that.
He says the question is, have you bought a smile only for smile? That means you would not do. There are a lot of people, but they're not in this hall today.
There are people who do only smile. We don't do it for several reasons. The most important one is the economical one. The secondary reason is that I've been doing refractive procedures since '94. So I also trust my other techniques. So wherever required, I do surface ablation. Wherever required, I do microkeratome LASIK. And I also do femto LASIK. So depending upon the need of the patient, in all respects, is
if
that what I
smile-
choose
if smile is
the
so much
procedure.
superior, why do you also offer LASIK?
No, I'm never claiming that smile is so superior. Smile has distinct advantages, and wherever those advantages are required, like say in close contact sports, or somebody is a swimmer, or wants to get married in a week's time, and wants to apply eye makeup, I would want to do a smile in them so that they would not have any flap-related issues.
Why not a PRK?
Because PRK will take 3 days to heal, and they will have to go through that pain.
Just
And
3
to
days.
have steroids for so long.
What about
And if it is a high myopia, there's chance of haze and regression,
if
which
you
is
ask
difficult
Rohit,
to enhance.
He will tell you that a PRK would have a less chance of ectasia compared to smile.
I can't comment. I'm a moderator.
which excimer laser are you using, Rohit, for PRK?
I use Alcon and Schwen.
And how long does it take with Smart Surf from Schwen to heal the epithelium?
12 seconds, 14 seconds.
Sorry?
Heal, 1.5 to 2 days.
It doesn't
2
take
days
a
at
week.
least.
Yeah. but
And
it
the
doesn't
person is
take a
getting
week.
married in a week's time, they have lots of preparation. You haven't attended any big fat Indian weddings, that means.
So you buy the smile laser for
Marriage.
the subpopulation of ladies that will be married
No.
in a week.
People who are in contact sports, people who want to go back to work quickly,
But even for flap
and
LASIK,
people who want simply the best,
We have a
and
last.
not want any pain.
what about value for money?
I have a last question. This is for Dr. Fogla. I just
Yes.
want you to see it here. Let's assume that you get this. What would you do? You don't have to pay
If I
at
win
all.
a smile machine,
You don't have to pay. It comes to you because you won in Vegas. It's a new scheme.
I will definitely incorporate it into my practice. I'm not saying that I won't do smile,
Good.
but I'm not claiming it to be superior than my topography guided PRK or my topography
And the
guided LASIK.
chance is that they give you this, but they take whatever the old machine.
I won't give back my old machine.
Rohit, if I win, then I would even take the
so I
Roulet
think-
machine home.
Yes. That's the best one.
Rohit,
you look very saintly here.
you are.
Still not convinced.
And last slide, I just want Professor Bellin to comment on this. Next slide. This is your friend. How much is this noise and how much is this music?
I would have
Gaurav
to,
want to say we have discussed about this.
I haven't read I would have to really read the article to answer that.
It's John Canillopo's paper, 2017. He says that topo-guided versus this one. But what is interesting in this paper, which I want Dr. Fogla to comment, is why is his LASIK surgery results so bad? Forget the smile.
Anadi
His
ka khelna khel ka
LASIK surgery
satyanash.
results are 87%.
Okay.
If you really look at his paper in depth, you'll realize that his LASIK is also bad. He's a good surgeon, we all know. There's something to do with his machines then.
Also,
Well,
Rohit,
just reading the conclusion, what he says, at least from the rest of the literature, is correct. I think from a refractive point of view, LASIK at the moment gives better results than SMILE. And part of that is also due to the limited range of SMILE.
You read this paper.
And he's not really addressing anything else in the paper.
I mean, the reason I put this paper was, it is not just SMILE that he also claims, he's comparing both. His SMILE results were very bad, that's okay, we agreed.
but
What,
LASIK
but
results
LASIK
are
is
also
also bad. That is my question. Why? Femtone.
Fem2.
But his residual refraction cylinder was less than 0.25.
If you read his whole paper,
Yeah.
you know, he has put those efficacy safety graphs. That is why I said I wanted the comment is, it may be a good paper, I'm not denying that, but there is sometimes we have to really look into the depth of it.
moreover, I think, there was, I have been through it, so I know there's a learning curve, and, first 100 eyes in SMILE, you probably just kind of getting used to it. The machine is, needs more calibration. It takes time to settle in, so it's only after your first 100. These were the eyes which he did the first 20 or 30 eyes on a borrowed machine. He's never done SMILE after that. You can't possibly compare an experience of doing 20,000 LASIK procedures with the first 20 eyes that you do on SMILE. That's probably the biggest flaw in this paper, I would point out.
But there are other papers as well which compare looking at SMILE versus customized LASIK.
But anyway, thanks both of you for being such good debaters.
Thank you.
And
Rohit, I also take this opportunity to thank you. My friends always, when I give a talk, I send them a picture. And they would always try to find me and say, where are you, where are you? Because I'm never seen behind a podium, being so short. So they always advise me, you should take a stool with you, stand on it. Today I'm going to send them a picture where I am also visible. So you've converted me from Mr. India to Miss India. Thank you.
And sir, we are going to remember, if you win a Vegas SMILE, how well you're going to use that.
No, it's again, you're missing the point. Between all the procedures that you have, it's not like one can
I'm
do
just joking.
everything. But the